Hi everybody, I'm Josh. This is Gabe from Balanced Body Rehab. And Gabe and I were just discussing some of the most common problems we see in the office. And one of the most common problems we see in the office is people come in with one-sided back pain after sitting for a long time. And automatically when I hear this, I want to ask, how are you sitting? And a lot of times people have a tendency to sit onto their left buttock. They'll tend to bias themselves to that side. And the reason is, they tend to bias themselves to that side so they can drop this side down and use their right arm for the everyday activities. Okay, and they don't even realize they're doing it. But whenever they sit onto their left buttock, what it does is raises up the right side of their pelvis and makes them really tight on these muscles of the right side of the lower back. And that's what can contribute to pain, either compression on the right side or an overstretch on the left side. And that can cause buttock pain as well. People that tend to cross their legs tend to cross the right leg over the left more so, and that can cause an imbalance. Similarly, if you cross the other leg over all the time, that can cause a different imbalance as well. But commonly, it's the right leg over the left tends to cause the problem and tightness of the right side. So we're just going to show you today is some simple ways you can self-assess whether or not you're sitting crooked, and ways what you can do if that's the case. So what I tell people is, try to, Gabe, let's show them here. Go ahead and sit onto your left buttock. Just lean that way and raise your left arm over your head there. Okay, and go ahead and bend that way. And just get a sense for how tight you are along that side. Okay, and then do the same thing to the opposite side. Sit on your right buttock and then raise that arm up there and get a sense for how tight you are on that side. If it feels the same side to side, then you probably don't have much of an issue. Also, Gabe, just try to wiggle your bottom to the left versus the right. So again, if you don't have any problem, if you don't feel a restriction there, then you don't have much of a problem. But if you do feel a restriction to one side, or you just feel like it's not opening up as much, that's usually an indication that you're having a bias towards one side. And a bias towards one side for a long period of time can cause some stress or strain to the area. So what you do about that is, whatever side feels more tight, in this case, we're going to say it's Gabe's right side that is a little more tight. Then we want to go ahead and sit onto the side that's more tight. So sit onto your right buttock, Gabe, and then raise this arm up and really get a stretch. So the assessment becomes the stretch. So if that's where he's more tight, that's what we're going to have him do. He might have some tightness that is really locked up in here. So before actually getting into the stretch, we'll have him take his knuckles and get in there and dig on those tight spots in his back to help unlock that a little bit more, and that'll allow him to get a better stretch. We can also have him sit on a lacrosse ball or use a lacrosse ball onto his back to help out with that as well. Also, because it's his tendency, it's his habit, it's tough for him to get out of that habit, I'll ask him to take a folded hand towel and place that underneath his left buttock at work. And that'll, for a week or so, and then that'll help reprogram his brain to not go into that habit again. So these little habits, these little techniques have helped a lot of patients, so hopefully it helps you as well. Thanks for listening.